Here's a question you probably never asked. Is it possible that taking a selfie with your smartphone could actually be good for your health? I'm Logan Plaster, host of Startup Health Now, and this week we're highlighting a founder named Kavi Misri who says the answer to that question is a big yes. With his company, Hibiscus Health, Kavi is building a platform where people can use their smartphone cameras to do facial scans that look at the blood flow in your face. This facial blood flow analysis is actually able to give a solid indication of diabetes risk and other conditions. One of the big ideas with Hibiscus is to massively lower the barriers to population health. Traditionally, broad programs that attempt to screen folks for things like high blood pressure have had low adoption rates. With Hibiscus, getting an initial health screen is easy and intuitive, and the adoption rates have followed suit.
31% of employees did the face scan within 48 hours of receiving the email. 67% of the folks who did the face scan found out that they had one or more chronic condition that they were not aware of. 70% of the people who did the face scan ended up scheduling an appointment with one of our dietitians.
One of the fascinating things I learned in this conversation was that their technology doesn't require some fancy new phone camera. It even works over a webcam.
While you're waiting on Zoom for that 2 minutes for people to join, you could have your...
Is that a thing?
Not a thing is yet, but it is a thing that we can do.
A quick note before we dive in that Startup Health is currently accepting applications for our cardiometabolic health moonshot. If you are building a healthcare company in this market and are ready to accelerate growth by joining a collaborative, mission-aligned network of founders, check it out at startuphealth.com. Now, on to the interview with Kavi Misri, recorded on the floor of HLTH in Las Vegas. Kavi, always good to see you.
Always a pleasure, Logan. Thank you.
Remind me when you started this company?
We started this company in June of 2022.
Okay, so it's been a couple of years, still a relatively young company. Kind of give me some of the milestones of the last couple of years and kind of tell me where you're at now.
Oh my, it's been quite a journey. We started creating our face scanning technology for early detection of diabetes. So we use facial blood flow analysis, looking at the patterns of the facial blood flow to identify biomarkers. So being able to do a 30-second face scan to detect diabetes risk, which ultimately comes from vitals, which are your hemoglobin A1C score, your triglycerides, as well as your cholesterol and blood pressure. And since then, we've been on a just massive velocity impact of becoming a Johnson & Johnson portfolio company, being a Startup Health T1D Moonshot company. We just became an AARP H-Tech portfolio company.
Congrats.
It's been great. We are credentialed with Aetna, Blue Cross, Cigna, United Healthcare, Medicare, Medicaid, so generating reimbursement revenue from them. Okay. So part of our model is that we are a business to consumer, so we sell our solution to employers as a way for them to provide the solution to their employees to increase access to care, especially when you look at rural places where we want to meet the patient where they are. By having this camera phone, or at least a smartphone, 99% of the country has a smartphone. Yeah. It's really ironic. We did a survey with AARP looking at hypertension and those with hypertension, and we saw that 5% of people with hypertension have a blood pressure cuff, but 99% of them have a smartphone. Okay. So it kind of validates the technology. Okay. So that's kind of like demonstrating how impactful this technology is, meeting the patient where they are, whether it's in the office setting, whether it's at home, but being able to remove the friction and the barriers to get their A1C score checked, which is ultimately required with a blood test.
Okay, so let's talk about the technology. Being able to scan your face, facial blood flow, and being able to detect a whole range of things. It almost sounds like a bit space age technology. And I'm sure that you're going to get some pushback from some skeptics saying it's not accurate enough, that, a better use case for your TikTok selfies. Now you're checking your health.
While you're waiting on Zoom for that 2 minutes for people to join, you could have your...
Is that a thing?
Not a thing is yet, but it is a thing that we can do, because we are able to also capture using a webcam.
No way. Okay.
So it can be a thing.
So we're not talking about like an iPhone 16 like quality camera.
No, anything above an iPhone 9 works, and a webcam.
Okay. So for a non-clinical audience, tell us how accurate this is.
So for the the hemoglobin A1C, it's a 85% accurate, meaning that 85% of the time it'll hit it on the dot. And when we look at it on a bell curve, the standard deviation is a plus or minus 0.01 for the actual A1C. For the triglycerides and the cholesterol,
How does that compare to standard of care?
standard of care is so an actual blood test is around between 96 to 98%. So it's below, but it's a screening mechanism that gets people into the door. When we look at your triglycerides and your cholesterol, it's 90%, so even better.
Okay.
And your blood pressure, it's 98% accurate.
And apparently these numbers are good enough that you've had these partnerships.
Yes.
J&J.
Yeah, so the numbers are good enough it's that we know that even though it's 85% accurate to the dot, it's strong enough for us to know if someone is pre-diabetic or not. And then the next step is essentially to get them to care. So we have a clinical team of registered dietitians who would then reach out to the patient and provide them with counseling, so dietitian counseling. And we recently completed our first enterprise B2B pilot, which showed that 31% of employees did the face scan within 48 hours of receiving the email.
Wow.
Which is actually a big wow for us and for the technology and for revolutionizing this type of care.
Yeah.
And further, we saw that 67% of the folks who did the face scan found out that they had one or more chronic condition that they were not aware of.
Wow.
And then further, 70% of the people who did the face scan ended up scheduling an appointment with one of our dietitians. So to really show you the true follow through with our ability to make this impact. And these are people who, for some reason, were facing barriers to care, whether it was the cost of care, whether it was inconvenience, whether it was lack of access, whether it was just the inability, lack of knowledge. And in this, when we completed the pilot, the data itself was just amazing. So we saw that significant clinical outcomes occurred where 98% of the employees improved with their mood, with their sleep, with their overall ability to make lifestyle and meal choices. We saw them lose weight and kept it off.
Yeah.
And further, we saw that 7% of the patients actually came off of a medication with the help of a PCP.
Wow. Okay. So my question now is, this seems so easy and so good. Are we going to see the market flooded with this? Are we just going to see everybody doing facial scanning?
Well, with the help of DLA Piper, we hope not. So we're in the works of our patent.
Okay.
So we'll be filing our patent next month to prevent that.
You have a proprietary version of this. Obviously, the idea exists.
The idea exists. So that's one of the things to also for people to know is that this technology has been around for quite some time, but for blood pressure. So there are multiple studies and actual pure clinical evidence on the efficacy of it for blood pressure. I like to say that we're not inventing the wheel, but we're transforming we're transforming a stone wheel into a rubber wheel, because we're building on the technology of the blood pressure by being able to add the A1C, the triglycerides, the cholesterol. We're also now doing R&D on the iris as well as the gum line.
Wow.
Because there's just so much data that we can capture on the iris as well as the gum line when it comes to cardiovascular health. So as you do a face scan, we're now collecting not just the facial blood flow, but the iris as well as the gum line to predict hypertension, kidney disease, even looking at early onset of dementia, Alzheimer's, and then like cancer down the line over the next 5 years.
Unbelievable.
Yeah, no, I think the more we look into it, the more promising the technology is, and the more our tech team is able to develop and extract the blood flow and then identify the different different.
Kind of one of the themes I'm hearing is like this is like an on-ramp. Not only it's easily accessible, find out what my challenges are, and then get into care. But then it's also an on-ramp to the complexities of the face.
Yes. And one of the things too is that with the pilot, we received an overwhelming response from mental health therapy as well. So we actually have just introduced mental health care into the platform, because you can't really have, you really need to focus on the mind and the body, and a lot of the emotional eating, a lot of the stress can either can affect your overall physical health, whether that's overeating or just not eating at all, and vice versa on the mental health. If you're in a certain mental health state, your chances are you're not cooking, you're not meal prepping. So we have now added a team of mental health therapists that can provide 24/7 concierge care, all the way from in the moment support to crisis management that goes along to help with that behavioral change, to really be that true physiological help to address the mind and the body.
I love it. Well, I appreciate you can give me an update. I hope that pretty soon on my iPhone I'm getting a health scan, and it's keeping me in touch with my doctor.
Sounds good.
All right.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.